So, Charles, why don't you first of all tell everyone a little bit more about who you are and what you do?
Yeah, thanks so much for having me, Adam. I think that was a great introduction. And just to add to that, yeah, so we've been running home care services since 2008. And I joined, and that was at Anglian Care, and we launched another office within Anglian Care and went through our digital transformation. And as you alluded to, in 2022, we decided to purchase Ashley Care. And Ashley Care was inadequate. And part of the reason, if I go into it now, was really at the start of the negotiations. It was Ashley Care requires improvement, and that's really where we started. And it was throughout that process, and that was about a 12-month process, that additional CQC inspections were coming in because of the concerns around the service. And unfortunately, they were re-rated, as you alluded to. And we felt that the decline in the service, and from the other stakeholders, so Southend Council, Mid and South Essex NHS Foundation, ICS, and also for the individuals in the service themselves that we were speaking with, as much as we could within the due diligence process, we had to do something. So we decided with our operations manager that we would go under the guise of CQC consultants and go into the service. So what we really wanted to find out was exactly what was going on in the service, how the team were thinking and feeling. I think anyone who runs a care service, one of the things that we always mark ourselves by and hold ourselves to is the CQC inspection and the rating. And it means so much because every single day, we're trying incredibly hard to ensure that we're delivering the best care services for all those within our service, and making sure that our team are rewarded and feel empowered to do their job to the best of their ability. And we wanted to understand why that wasn't the case. So when there's a service, as Ashley Care was, that was sort of declining and had been re-rated to inadequate, we realized that the rate of decline meant that we had to go in there, because if not, you have a completely fragile service, and then that could actually lead to the collapse of the service. So when we initially came into the team, we introduced ourselves as CQC consultants. We looked through all of their quality and governance, so that included all of their auditing, and again, that they were a paper-based system. And I think this is something we should touch on, Adam, but how much technology and digital social care records has transformed the sector. And I think this is now a given. It didn't used to be a given. I think there was some friction initially when they were introduced, and then now it's something that we couldn't do without. And we're going to allude to and speak about artificial intelligence and the opportunity there.
No, my question, if we can just go back a little bit, I'm curious to know what was thinking about deciding to look at so chronologically, right? Anglian Care was going on well. You've been running that for a number of years, right? And then you decide to purchase another company, and you decide to purchase an inadequate care home care company. Why is it you decided to focus on an inadequate provider?
When we first started looking to the market, local providers, we spoke with the previous owner, Vivian Story. She was a fantastic woman who's been in the care sector since 1987. And you can see she had tremendous experience in how to deliver home care and also previously residential care services. It was also a family-run business. So the culture and ethos of the company was to genuinely assist people and care for people in a way that we felt aligned completely with Anglian Care. And when we were going through the process of speaking with Vivian and the team, we realized it was mainly around that digital side, the compliance, the auditing, the governance, and how we capture the information of the care that we're delivering. So whether it's the electronic care plans, whether it's the electronic mug sheets, how we're auditing the monitoring, electronic monitoring systems. Mm-hmm. So there's a variety of different checks and balances that care providers have. And that's what allows us to then evidence the fact that we're delivering good, safe, effective care. So it was really that piece that we identified was the key determinant as to why they had such a poor rating, and that got re-ranked down to inadequate. So we felt at its heart it was a company that aligned to us, and I think that's really what drew us to it.
I see. God, it must have been pretty bad though on that digital side if it wasn't on that recording side to get down to inadequate.
Yeah, I think a lot of it was missing. I
Right.
don't think it was for the want of trying. I think sometimes there's been such a transformation and transition with care providers,
Yeah.
and now the expectation is that we will be able to capture all of this evidence, and we're doing this on a much bigger scale than we ever did before. And even if you look at capacity trackers, KPIs for local authorities, the CQC PIR, there's multiple examples now where care providers are sharing data, but
Well,
before we didn't even have the data digitally to then collate and share. So I
mm,
think the requirements on providers is changing and evolving as it should do. And that was really the struggle with Ashley Care.
yeah, I see. And so it was someone you knew within your network, is that right? Or were you actively looking to make a purchase, or how did that happen?
Yeah, I think there's a great network within Essex. If you look at the Essex Care Association, you look at
Right.
many care providers within Essex.
Yeah.
And I think there is a real coalition, and we share ideas. I think sometimes within the social care sector, there isn't enough sharing of ideas, but I think that's been rebutted in recent years. And really, sharing best practice has been a sort of a common theme, and you see that on LinkedIn, or you see that within the conferences that we go to, or specifically within the local associations. So yeah, I think there's a strong foundation.
All right, that's so great. So you had your eyes on it, and then I'm just very curious about the going in as CQC consultants. So, like, how did you like position that, and how did you actually go about doing it, and like, how did you justify it in yourself? Kind of, you kind of won't be a, you're kind of like undercover, so to speak, which is great. But tell me your how you went about it.
It always is a difficult decision to make, especially when you're doing something that may be seen as disingenuous, and especially as you're going to become the inevitable owner of the company. Integrity and honesty is one of the key
Hmm.
sort of pillars that I hope that our company has and that I have as an individual. So initially, it wasn't an easy decision to make, but I think that we have to keep the people who we're caring for and the service users of Ashley Care right at the top of our mind. Right, that is our focus. That is our priority. If you go from requires improvement and you go to inadequate, and you look at special measures, and you look at some of the warning notices and additional breaches that Ashley Care was under at the time, and the fractures in the relationship with the local authorities, etc., something had to be done, and we couldn't wait. And acts of omission was just as bad as actually doing something to harm or continuing down that same path that Ashley Care was on. So we couldn't. We had to act. So we introduced ourselves. We came in. We spoke to just mainly the management team, and we looked at exactly what the situation was on the ground. And then once we've done that and we've reviewed all of the governance that was happening or lack thereof, we knew what to put in place. And that was really the sprint. So we able to assess the situation, and then we knew on our first few weeks, first month, and unfortunately you can't time when the CQC come in. I know you've said around we did it within that month, and that's unfortunately we would have liked more time to then be able to put in the digital systems, but we understood. We met the team, so initially we're checking for culture. How are they motivating people? How are they, especially the care team, how are we communicating with our care team? I think that's probably one of the most essential parts of running a home care service, because that feedback loop, when you have lone working and people are traveling from house to house, how they then connect back to your organization so they don't feel like they're out on their own is so pivotal to the morale of the company, to the engagement of your staff's employee surveys. And that's really your litmus test, right? But if no one feels engaged, if you're never closing that feedback loop, if you're never communicating well, then the care team feel like they are in isolation out there delivering the care. So that was one of the key aspects that we pinpointed, that we really wanted to target, which led us on the very first 2 days. I'll never forget it. It was a Thursday was my first day, and Friday was the second day. And on the Wednesday, once everything had finally gone through, I said to every one of our managers, please send a global email out from everyone to everyone, but from 5 different managers, so everyone could make sure that they definitely received it. And I asked for as many people to enter the office. So I think at the time there was around 75 employees within Ashley Care. And over that 2-day period, I had a revolving door of 15-minute segments of individuals coming in. And once we had gone past the CQC consultancy part and actually in there, it was so refreshing to hear exactly the transition that Ashley Care had taken. And you will never get as good a feedback often than the people out there delivering care. And I truly believe if you listen to your care team, one of the best things about delivering high quality care is obviously continuity of care. We talk about it, but then how can you have that at the same time of having retention and turnover issues? So you really need to fix on the continuity of care and therefore fix the retention, therefore solve the care team's issues. And that's how you're going to deliver good care. So that was really important sort of fact finding exercise. And then that gave us a lot of work to do in the preceding month.
Yeah, yeah. And were you undercover, so to speak, like before the purchase?
Correct.
Yeah, yeah. Before the purchase makes sense, of course. So, and after you've done that undercover and you revealed yourself to be who you really were. So were you involved yourself directly, Charles, on this, or was it part of your team that went undercover?
Operations manager was here every day, or most days, 4 out of 5 days a week, and I may have came in once a week. So again, we were trying to keep this really light touch. We didn't want to impose on the team, and also just from a perspective of acquiring a company, it's not done yet, is it? So you're doing a lot of work, and we're putting a lot of legwork and time and effort, and we wanted to improve the service no matter what. And we felt that even if it unfortunately didn't go through, which it did, we could hopefully have just imparted some of the improvements that we would have made anyway.
Sounds great. So I'm just curious, Edward, but you would have been known to the owner, right? So you went into the office when the owner wasn't there. How did you do that?
No, she was there. She was there. So yeah, that was absolutely fine. And we had agreed that this would be the case because I think everyone realized the urgency of the situation.
Yeah. All right. I see. So, but just make sure I completely understand. I'm very, very curious. So the owner thought that although you were a prospective buyer, but did she know you were a prospective buyer at that point, or was then like coming in as a CQC consultant?
Yeah, so we had agreed the only way that this could work was that if we went under the CQC consultant role, because that was the only plausible explanation as to why you'd have an external party there. So we needed that to happen, obviously, but she also realized that we had to do it now. So it was kind of a mutual agreement that
it was a mutual agreement between you and the owner. So but it's just between you people. It wasn't like the rest of the team didn't know that. I see. Yeah, I see. It makes sense. You know, and how interesting. Okay, great. And so that was around 2 months, you say, right? Is that?
Yeah.
3 months. And you must have gained a lot. You must have really known them by that after that.
Yeah, I think we had a pretty good idea. We had some really long conversations on how we see home care and how you structure. And I think that was one of the things that stood out the most, actually, is when you look at a company that's declining, it's really how those roles and responsibilities shift. Normally, you're doing that when you're increasing and growing, and then you're changing roles and responsibilities as people are growing their individual teams, as you need more supervision. And normally you're trying to restructure things as you're growing. But I think because of the rate of decline, one of our initial jobs was actually, okay, how do the roles and responsibilities look now when maybe the company at 75 individuals is half the size that it was 2 years ago is at 150. So it was, where are those roles and responsibilities, and who's still motivated and who really wants to turn this around? I think that's one key aspect when we came in with hopefully the energy and the direction. It's then who wants to come on board for this journey. I think we all know the challenges with social care and how difficult it can be, but also how rewarding it is. And those who are committed to our direction of travel, I made a few early promises to the care team. I said, stick with us on the digitalisation, and we went through a consultation period. It will make your lives easier. Many care providers have gone through that over the last few years, and trying to spell out and educate and really show the team the benefits there. So thankfully all of the care team are on board with that, and that's proved to be really beneficial for them. We also said we were going to do care team pay rises, and that was one of the initial sort of strategies we had to really reward the care team. The mileage went to the maximum of 45 pence. And we looked again at people's availability to give them the option, does your availability and flexibility of work still work for you? So we were trying to show that it wasn't a case that we were coming in and looking to change everything, but we were coming in and looking to go back to square one and say, is this role working for you? If not, how can we improve it? And how can we improve the people that are actually delivering the care? So how can we improve their lives and their working conditions? And I think that meant that the care team overall was really sort of pleased. They were motivated. They were really ready for this transformation that we went on, and that then we coalesce around that. Our managers then feel that energy. And then it was about, okay, the care team are doing a great job, but then how do we evidence that and show that? So once we had spoken with the care team, we said, look, you're one of the most important parts of all of this service. And I think just hearing that and then hearing the reassurance that we do think that they're incredibly important, and they're really at the heart of all of this. And we don't feel that, I think that's another point that was really interesting actually when we first showed up, is I think sometimes with your CQC inspection, you almost wear it like a badge. And I think some of the care team wondered, is it the care that I'm delivering, that's inadequate? I don't feel like I'm delivering inadequate care.
So, yeah.
But it's not. Many of those individuals were delivering incredible care. I was hearing great stories about how we were helping people out into the community and really tailoring what we were doing to meet the people's needs in terms of what's their preferences in food and drink. And I think when we were seeing so many examples of really high quality person-centered care, we reassured the care team that it wasn't the care that was being delivered that was necessarily inadequate. We have to take responsibility. And we'll put the governance in place, and then we'll see if we can improve the operations of the business. And really, that was the point in which, if we did those improvements, we felt that Ashley Care is a good or even outstanding provider. And maybe we'll come on to this, Adam, but since that last 16 months, we've been in the Capturing Innovation to Accelerate Improvement report by the CQC. We presented at a CQC roundtable for our project with the Razor Chair. Within the Razor Chair, and this is in partnership with Felgains. They have the helpful assessment tool. We decided to self-fund 2 Razor Chairs within 2022 winter. So that was our first winter, and we felt that there was 14-hour wait times. So we decided to self-fund 2 chairs and showed that we could save over £40,000 over an 8-week period to the NHS, to Southend City Council, and to us as Ashley Care, of preventing people going into hospital. So in that Capturing Innovation to Accelerate Improvement, and then further, we were then within the State of Care report. So we've seen that from an inadequate provider, we're then shown as an example of innovation within the State of Care report. And I think that's a testament to that change in mindset from coming in and we're looking at what we're doing wrong to, okay, we've put all of the governance in place that we needed to. Now, what more can we do? And if you think about it, within the first year in 2022, we were out delivering and raising people off the ground, and then we were preventing them from going into hospital, stopping the long lies. And that was really a great example of how quickly you can change the culture within an organization to start thinking about how we can become outstanding.
That's great. And Charles, I just want to focus on one thing you mentioned, which I'm very interested in, is talking about engaging members of your team who, as you say, are out and about, on the roads and going to visit clients for example. And for those listening, give us a couple of tips as to how you can start to think about increasing or amplifying that engagement.
Yeah, there's multiple different small aspects that you can do, practical sort of tips, as you'd say. The employee survey, first of all, is not just for show. We do it multiple times throughout the year, and you need to pick up on the small aspects. So just to give you an example, we had one of the people that walked between the homes, and again, we're looking into winter, and he said, I'm often cold. And it was a small survey response, and I picked it out and said, okay, immediately, let's get him a jacket and let's have it Ashley Care logoed. And then many more people then saw that jacket and wanted it. And it's something as basic as a sort of North Face, really padded out jacket for people who are out in the cold weather. It's a small thing, but we need to pick up on those small things.
Yeah.
Another person who was caring for an individual who smokes within their homes. Can we get a more industrial mask that actually filtered through some of the smokes? And we're not just talking the normal mask, we're talking a more industrial mask. So we went and bought that. So again, a small thing. People need to know that if you're asking for their opinion, it's then listened to, because then if not, then they won't. What's the point of ever saying something's right or wrong? And I think another part of the learning culture we hope we've fostered here is we seek out criticism. I think it's the job of some of our management team and us to acknowledge, recognize the great work that's being done, but also the ability for us to self-reflect and say, what more could we do? So if someone talks about how their rota and their availability within their supervision, then we need to look at that. If they're talking about annual leave or having to take emergency annual leave, we need to look at that. Compassionate leave, we need to look at that. So there's small requests that your care team will have. Again, is there anything more in terms of mental health support? If someone's reaching out confidentially to one of our managers, I don't need to know the details, but I can definitely, if something's raised in an anonymous way, say to that manager, is there more support we can put in? I don't need to know the details, but here's maybe, even if we can, a budget, and please ensure that person receives additional support. So it's picking up on those small things. Open door policy, but not just saying you have an open door policy. Encourage people coming in. When someone comes into one of our offices, it's almost got to be everyone smiling, hi, how are you? Really caring about that individual, because we're all trying together to collectively care for the most vulnerable in our society and the most vulnerable in our community. But we can only do that when we're on a joint mission and we're all aligned, that we're caring people that I do actually care, and everyone within our team does actually care how each other are, just on a personal level. And I think if you foster that sort of culture, then people then do come to you more. And then what you find is that you're able to work through together, but at the same time, you'll find that they support each other more because there's strong bonds within the team. And that's been a really important and great journey that we've gone on here at Ashley Care.
Yeah, that sounds great, and I can see what you've conveyed well. What you did here, there was obviously the digital side, which is very important for this particular for Ashley Care then, and then the vision, the culture, the working practices, working as a team, all of that culture element, as it's called, has been so vital. Is there anything before we move on to the AI, and you did this quickly because, as you can see, came in obviously quite quickly and ramped you up to requires improvement, which is great. And so, and then you've been moving forwards on from there. So before we come on to the AI element, which we are keen to touch on, is there anything that you've not talked about that you think is important to convey, particularly on this like fast turnaround?
I think we spoke about communication with the care team. In addition to that, a clear, concise strategy moving forward and framework. And one of the things that we implemented within Ashley Care was we have monthly auditing. The cadence of meetings have increased massively, and I think that was another stark. And that now we're talking internally within the management team, the coordination team, the finance function, HR, etc. The cadence of meetings increases, but that doesn't mean having multiple hour-long meetings. But it does mean touching base in a designated time where people can bring up openly, frankly, and be able to share some of the challenges or opportunities that they have within the team. So having those meetings, and I think that's something that people then look forward to them. They're able to say, we'll save that for the meeting. We'll get everyone's opinion. So everyone's downloading at the same time. They're digesting the information at the same time. And then we come up with a joint solution and we can attack it for the next week. And I think that's extremely important. And another aspect that I would say that we implemented early on within Ashley Care is the lack of people who weren't enrolled on their MBQs or additional qualifications. Some have been on the level 3 award in education and training course. And when we started offering these courses out to people, and this was in the first few months, I think they were shocked that we even could offer those courses out. But then the cascading effect of that was once they were enrolled, they would touch base with us. Oh, I've done another module, and I've done another module, and I'm 6 months into this, and I'm really enjoying it. And they can see the progression, they can see the career progression, and they can see the different roles within the team evolving as we're now growing as well. So those learning and development opportunities are really important, and sometimes you don't wait for the person to say, oh, can I do XYZ training course? We need to actively be looking at the individuals in our team and think longer term, could this person grow into one of the positions that we need maybe in a more senior role? And therefore, what training would they need? And can we do that for them? And I think if you do that, then you'll find that they'll be really motivated, and they'll be really pleased that you've seen something in them, and therefore give you a lot back to the company and those we care for, and the team in general.
Great, fabulous. So thank you. So let's move on to Emma.ai, what it's looking to achieve, what the aims are, and how you think it may be able to help the sector in general. So yeah, it's tell us where you're at with it.
The journey with Emma has been incredibly fascinating. One of the things as me as a care provider is I've experienced many challenges that we've sort of touched on, and many great things about the sector. We have decided to build Emma.ai, but also build it in collaboration with care providers. So we started this with the Care Leaders Network, and I think the Care Leaders Network is a fantastic place to really co-produce and collaborate with the care sector. And we started by doing a workshop, and it was really education at the start. This is what the technology can do when you look at large language models, natural language processing, and this is where we can go. And from that point, we received a lot of feedback on what would be the best use cases. And then transitioning that to the launch event, we found that there was a great reception from what we were trying to do. And if I were to sum it up, I'll talk through the journey of data and digital within social care. And this is something that I've experienced, and I think many people will be able to understand this journey. So we started really with paper, and we were sifting through all of the information in filing cabinets. And then as that transitioned to, instead of sifting through filing cabinets, we're clicking through digital filing cabinets. Then what we're able to now do, and off the back of going digital, you have more structured data. So instead of handwritten data, you have formatted data within a digital product. So what does that allow? So that allows us to then analyze, audit, reports. We're able to interact with that data in a much easier way and get more information back from it, even if you think of electronic care plans, electronic mark sheets. And now really the next inevitable step, because we need to now look to the future, is what do we do next? And we go from sifting through paper filing cabinets, clicking through digital filing cabinets, and we're really going into an era now, and we're just at the start. So again, the specific use cases, and we can talk about some of them at the moment, and what we're trying to tackle at Emma, is we're going to be able to speak to our data. We're going to be able to ask a question, not click through, not trying to find it, not trying to find multiple different forms or areas or portals that we have all of our information stored. We are simply going to ask a question and receive an answer. And that answer will be dependent on the large language model and the company and the AI that's used to do that. I think AI is segmented. So we look at machine learning, and many companies talk of their AI, but it's really around algorithms, and it's lesser around large language models. So if you take large language models, it's able to essentially scan multiple data sets across thousands of parameters, hundreds of thousands of parameters, synthesize it, and give you a simple answer. The benefit of that is going to be the same productivity gain that we've seen from paper to digital, now digital to AI. And really where we're going with Emma is we're going to be able to look at the different platforms that care providers are using, try and find a holistic picture of the individual, but also as an operation. And as our consultation with the market, we've seen that multiple providers are using a mosaic of different digital products, yet they're not utilizing them together. And the benefit of what we're developing at Emma is the ability to not only, if we take one of the current use cases of AI, for example, and put Emma to one side, you're seeing that people are generating care plans, or saying, let's generate AI care plans, or let's use AI for copy. And I don't think there's a place in care for AI care plans. I don't think you should dilute the data source. any technology company, in my opinion, that tries to come out with a product that dilutes the data source of the person-centered care, I think it's the wrong use case. I think better than we need a place to bring them together. And then we need a technology that's able to smartly, once you query that data, pull those different aspects together. And I think that is the use case with AI that is going to bring the most value to care providers operationally and efficiency, so that they can relieve their team to allow them to focus back on the care delivery. And that's really the use case that we're trying to tackle at Emma.
I see. So you're much closer to this than I am. So here goes. So how does this look in practice? So it's like a written question telling AI what to do, and then AI goes and does it, and then come back with a written response.
Exactly that. So it's a conversational interface. And a conversational interface is going to be, in my opinion, when we look back in 5 to 10 years' time, I think most enterprise software and consumer software will be conversational, because we text our friends and family enough, and it's the easiest way that we can communicate. And with natural language processing, that's now possible. And when we look at our digital social care record platforms and many other platforms, they're very good at capturing the information and storing the information. And what AI and Emma and what we're doing with large language models is able to do is pull the best parts of that as well, and then tie that into maybe some of the other different data sets that you have. So that might be the policy and procedure, or as I say with care homes, as Internet of Things. If you look at the future advancements of telecare and Wazan Digital being a remote monitoring system, I think we're going into a place where they call it hospital at home. And I think especially within that environment, you're going to have more and more information. And unless we're bringing this together, there's going to be no way of us making sense of it all. And we might end up having data overload. But the data overload isn't really about that we have too much data. It's just that we can't access it in a format that's accessible enough, inclusive enough. And natural language processing, just by having that conversation, means that we can interact with our data in a way that we interact with our friends, rather than interacting with it through these complicated platforms and then trying to have multiple of them open at the same time to try and get the information and a holistic picture on any individual organization.
So where's the Emma.ai then? A few questions I have with it is, so would this classify as a tech startup? Do you have like funding for it? Do you how and that's my first thing. And secondly, is this, where are you in imagining in your own mind as to when, like, here's a product that care providers, home care companies can use?
I'm really pleased to say that we have our first customers who are live. So that's fantastic. And home care providers are using it in terms of access of information. And that's really a support tool, 24/7 support tool for their team, to be able to take. We did a study within Anglian Care and found that we're spending roughly 4 hours per week, if per 15 people within the care team, 4 hours per week, retrieving and regurgitating and reciting documented information. And that was really when we did an analysis on telephone calls made and answered. So what we found was managerial bandwidth is extremely it's a challenge right now. And if you look at the CQ Skills for Care report, you see a 5.6% increase in turnover rate of registered managers. So I feel that's because there's too much being put on registered managers, and we need to actually try to alleviate that burden. So really the initial use case of synthesizing the information is to provide that support so that care teams have a 24/7 Emma support tool, so that they can query information, so they don't necessarily have to reach out when it's not required. And again, this is going to be information that's going to be more consistent because it's coming straight from the information that you have. So no person has tried to remember, oh, XYZ about the individual. And so it's going to follow your policies and procedures because, again, that's in the database. So it's more accurate and consistent, and it also alleviates pressures. So that's the initial use case. But then as as you grow the data sets, you grow the usage because you're able to not only look at the individual, but also the organization in general. So we are a startup. We have good traction, as I say, with the team. I think the sector's ready for it. They're extremely receptive. I think they really appreciated, and we've really appreciated the feedback and consistent conversations that we're having. And we're really led by the sector. We're care sector led. We're not here to implement any one technology onto anyone. We're here to educate the possibilities and then listen to the sector and really be driven by that.
Charles, I'm going to give you another curiosity question from me, because I found you're obviously, this is an area that you're kind of really leading on. So where did you start? I mean, so you have to get AI people like programmers who know about AI. Are you like, okay, you're going to come and help me sort out this problem? Is that how it works, or do you like find out what's available on general use to develop this system? How does it work?
Well, I'm really fortunate to have known the co-founders before Emma, and for good or for bad, they've heard me speak about the care sector for many, many years. So they know exactly my opinions on technology and the ability for technology to hopefully improve care. And I firmly believe that. I think that's our only way out of some of the crises that we face within the sector. So George, our CTO, has a master's within AI and neuroimaging. And Ryan again has a strong product side. So fortunately, we did have two co-founders who are able, from a technical perspective, to really work with these large language models. And as we transition, it's going to be about how you constrain these models. One of the interesting aspects of large language models is they're able to do so much and synthesize so much information. And there's different arguments for bigger models and smaller models. And the benefit and efficiency of those. But really, it's how do you constrain them? Because remember, we're in a sector where we're talking about high risk queries. This is another reason why we've taken so many steps in safeguarding. One of the points of our technology, we no longer run a black box system. So within AI, it's normally a black box system, and you don't understand necessarily how the AI has got to its answer. But we have a completely open system. So we're able to audit and understand exactly the synthesization process that the AI has taken.
Right.
And that means from an audit, safeguarding, safety perspective, we're actually to have not only higher accuracy because we're seeing that in real time, how that's working, but also for care providers to give them the assurance they are able to see exactly how we've got to that information.
Fabulous, fabulous. Look, it's been, I'm very excited to learn, follow Emma.ai and number one, and thanks for sharing everything you've done with Ashley Care to turn around the fabulous episodes. Now, if people want to get in touch with you, they want to learn more about Emma.ai or everything you've talked about today, how can they get in touch?
You can always send me a message on LinkedIn, so that's Charles Cross, or you can email at charles@askemma.org, and I'll be happy to answer any questions or explain through any of the technology.
That's great. Charles, thank you very much for being on the Care CEO Success Stories podcast.
Thanks so much, Adam. Cheers.